HEPPAC, first of all, is an organization that I think is way ahead of its time.
HEPPAC is engaging with persons who need our services, whether they know about it or don't.
And I have to congratulate HEPPAC for stepping out there early on to try, even before needle exchange programs were legal, for really recognizing why needle exchange programs really help reduce HIV and AIDS. And we're going to continue to work until we lift that federal ban on needle exchange programs. And again, HEPPAC is playing the lead on all of these issues.
Harm reduction, I think, is the most important concept to fully understand when it comes to improving the public health of the community.
You know, if you can do a couple of incremental changes, you're more apt to end up getting a better solution at the end of the day. But you've got to start with incremental.
By us passing out syringes, exchanging syringes, a person is able to use a clean syringe. Passing out condoms, a person is able to use condoms and keep themselves safe. Also giving a person hygiene kits. Maybe they are homeless, and that gives them a sense of taking care of themselves.
And I think when you look at the issue of specifically drug use, because I think that's where it comes up the most, and needle exchange has always been the thing that seems to be the most obvious in reducing that harm.
It's not about the fact that a person ingests drugs. It's not the problem. The problem is that they have things that are risking their health, and they have things that are affecting even the greater community outside of that themselves.
But we're also interested in getting them to a place where if they have this addiction, let's manage it, let's reduce the harm it does to them and the people around them. Let's think about practical things that are going to move them more towards sort of the kind of health outcomes that we're all interested in achieving.
And also we have to address the social determinants of HIV and AIDS. We have to address unemployment, homelessness. We have to address the lack of affordable and accessible health care. And so harm reduction really is, and as HEPPAC has shown, a very comprehensive way of approaching the issue of drug use, HIV and AIDS, in a very integrated approach.
Kaiser Permanente has been in partnership with HEPPAC since 2009, and we're very pleased to provide financial support to the types of programs that HEPPAC has for outreach, particularly to the minority community and adolescent community that high vulnerability and at risk. It's very consistent with our mission to try and help improve the community health of the areas in which we provide service. We are very pleased that HEPPAC has a success record of reaching these groups and reaching that population effectively.
So in terms of managing your public health budgets and managing the costs associated with public health problems, groups like HEPPAC are really important because they're dealing with the folks who are in the worst shape and who need the most resources, but who, if you can help them and tap down hepatitis C and prevent HIV transmission and reduce STD spread, you're actually getting more bang for your buck working with those.